Georgina Wood is a junior doctor, but you are also the organizer of this choir, a choir which came in front of a BBC to sing Save Our NHS. Why did you decide to come just in front of the national television for this purpose?
So, as you say, I'm the founder of the National Health Singers. So we're a group of mostly junior doctors, but also other health professionals that support us and the junior doctor plight. And we've travelled around a lot of destinations today, supporting the rest of the junior doctors that are striketing and picketing. We've come here today specifically because we want reporting to be fair and true to what our message is, and that also goes out obviously to the BBC to help us to get a message across. And we'd like them to help us.
How has the report been till now?
There's been a lot of coverage, as I'm sure lots of people have seen in the papers and on the television, and a lot of that we've been able to get some of our points of view across. However, unfortunately, throughout this whole process since the summer, there has been some mistruths about junior doctors and about the reasons behind why we're striking. And our main message for that is trying to get across the fact that we're doing this for the safety of our patients, and we need to make sure that that is broadcast in the way that it should be.
Which are the main mistakes in information till now?
So there's been a huge amount of discussion about the fact that we're striking purely because of pay, and that is untrue. And I was going to say it's a lie, and that we've never asked for a pay rise. Pay has been, as part of the whole issue with the contract itself, has obviously been brought up, but that's not our main aim. We're worried about the fact that if the government's plan to have a fully 7-day NHS is just using the doctors that are currently available working for 5 days, you can't do that without providing extra funding, and that's a very different issue to what we're talking about with pay, and that's highlighted and simply untrue. We're worried about the safety of that. If you don't increase a workforce to cover those extra days, then it won't be possible to provide a safe service, and that's what our primary concern is. And we all work a 7-day NHS anyway. We work 24 hours a day, 7 days a week, and that exists as a 24-hour NHS. And that needs to be addressed, the fact that it needs extra funding if that's going to be the government plan. It can't just be overstretching, overtiring and overworking junior doctors, which will then cause harm, potentially, to patients and possibly to themselves.
There's a couple of spaces to King's Cross. If anybody's coming.